We have patients from all over India. We may have patients from Zambia and Tanzania.
Gosh.
We may have from, I never check, but I have doctors who have the numbers. And Susie Stanway, you know, does a lot of work in Africa. So she sends it to her breast group. So sometimes we have patients from there join in as well. And Katie Wakeham from, she's a clinical oncologist in UK, which she does a lot of work in Uganda.
Goodness.
So
very global. We're suddenly all connected.
So yeah, and some patients from London. I think there's one I definitely know who always joins, and there may be 2, 3 more. So we are trying to make it through, you know, we had this meeting, you came to the meeting last year, that young women.
Yes.
So through that.
Oh, no, I didn't. Sorry, Pav, I didn't come to that.
No, you didn't. Yes.
No,
so
I didn't come to that.
So we are trying to make it global so that, because the problems and issues that women have all around the world are the same, they're not different. And so rather than, and I think this whole concept was started by Anne Partridge at Dana-Farber. So hopefully we'll get her to join in as well. And
I did see a message as well. There was a dietitian, a practicing dietitian on the group. I think somebody put in the comments.
Amita Singh, yes. No, practicing diet consultant. So
yeah.
Skin changes on post-treatment.
There, waving.
Okay. Hi, Amita. Nice to see you here. So great. So I think it's 6 p.m. What I would suggest is, ladies, we will record this meeting because a lot of people have said, if you're okay with it, Claire, are you okay?
Yeah, that's fine.
So if you could just take off your videos for anonymity's sake. And so usually it's only 3 or 4 people who are seen on the side. It's me, Claire, Riverroot, and Sachin from Riverroot. So, but if you could just stop your video, that will be great. And you could put your questions in chat, or you can ask yourself as well once we finish the talk. It gives me great pleasure to introduce Claire Shaw. I think I've known her right from the day you joined the Marsden, Claire.
Yeah, something like that, but I can't remember. It was so long ago.
It was so long ago.
Yeah. I could say how long I've been at the Marsden, and then that might shock you.
Yes, yeah. I mean, I was there for almost 13, 14 years. And so you were one of the first consultant dietitians in the whole of UK. And I remember you've written books on diet and breast cancer. And I've been to at least 6 hospitals where I've implemented your patient information leaflet. And you've been very kind enough for me to modify it, even at Bath's Health, in Narayana, in Tata, in Max, where we've just modified your leaflet, and I email it to all my patients. And patients find it really very, very useful. So thank you for that. You've always done that. And I mean, I hand over the floor to you to talk.
Lovely. Thank you.
Thank you so much.
And when we're updating it shortly, so I better make sure I send you the updated version.
Yeah, that'll be brilliant. Thank you.
Yes, we're just looking. So thank you so much for inviting me to speak this evening for you, this afternoon for me. And I'm going to talk for about 30 minutes and then open the floor for questions. So very focused on diet and breast cancer. I'm really aware that it's very, very difficult to filter out the headlines you see in the newspapers, in the media, and really understand whether those are, firstly, are they based on good evidence? Are they something that apply to you as an individual? And then if you have a diagnosis such as breast cancer, you know, how important is that in what you're doing with your diet? So hopefully this evening I'm going to talk about what is the good evidence. Where do we have some evidence? Where are we not so sure, but we've still got information about healthy eating? So these are some of the headlines that I'm sure you see in the newspapers and magazines, and you think, oh, the headlines often draw you in, don't they? But you think, is this really true? And is this something I need to do? Do I need to change my diet? So I would like to, I would like to direct you to a very good source of information. It's produced by the World Cancer Research Fund. Now, this is an American, it's affiliated to the American Cancer Research Group, and it is a global institution that looks at the evidence, published evidence on diet and cancer. And they have produced a report every 10 years. The latest report was published in 2018. And what they do is they look at all the evidence for the diet and causation of cancer. So then we have to think, well, is that evidence base still the same if somebody has had a diagnosis of cancer? And the World Cancer Research Fund have also published what they call their continuous update programs. So they have published on what is the evidence for people who've got a diagnosis of breast cancer. So I will look in a bit more detail about those recommendations. So the World Cancer Research Fund recommendations are really the best evidence-based information we have about what we should all be doing. And then, as I said, I will tease out the things that are particularly applicable to breast cancer. So I will be going through these in a little bit more detail, but you can see, I have a feeling quite a few of you listening, some of the things I'm going to say today, you will already know. You'll think, well, that was, you know, I already knew that I should be doing X, Y, and Z, which is good, because that hopefully means you are, you know, on the road to really thinking about how well you're eating. So I'm not going to talk through these, but if you ever want to look at this in a bit more information, then the World Cancer Research Fund website is a good one to go to. There is an international website. There is also, I always go to the UK website, and there are recipes on there as well, which put these recommendations into practice. And that's really important, because it's all right when we talk about food and nutrients, but we eat meals and we share meals with our family. So it's really important to think, what does that mean when you have food on your plate? So I'm going to focus on things that are really more important, I think, for breast cancer. And this first one, I'm sure you already know, being a healthy weight is probably one of the most important aspects of health, and particularly in relation to breast cancer. So some of you might know how to calculate your BMI. Those initials BMI stand for body mass index. That's about your weight to height ratio. If you don't know how to calculate it, if you look on the internet, then there are lots of websites where you just put in your height and weight and it will tell you what your BMI is. It should be between 20 and 25. There's a little bit of a discussion, does it matter if it's 25, 26? Probably not at the lower end, but once it starts to go up, then in terms of your overall health, and particularly in terms of breast cancer, that is something that it might be that you wish to think about for yourself. Also healthy waist measurements, both written there in centimetres and inches. That is actually more a risk factor for other conditions such as diabetes. So important. And really what these measurements give us an indication of is a weight that's good for health, but we also need to think about physical activity, because it's also about body composition. The ideal is that you have good muscle mass, and that comes from being physically active and exercising, and amount of fat that is proportionate. So we now know that it is a little bit more important to think about your physical activity and your exercise and your body weight. So it's not just about weight, it's about some other factors as well. I do apologise for there being a photograph of a man in the cartoon here, but I couldn't find the same picture at short notice with the lady in. So some top tips, and again, any of you who've tried to lose weight, you will have things that you know make a difference for you. And these are some top tips that, you know, people tell me help. But also I would say, if you really feel you need to think about your weight, then there are some tried and tested ways that are helpful. So slimming clubs, a lot of the slimming clubs you can join online nowadays, and the fact that you check in regularly, you meet other people who are struggling in the same way, and you get to connect with other people and get that advice. They are a very good way of spurring you on, and really they've been demonstrated to be very successful. Anybody's having treatment, they need to check with their oncologist that it is okay to be thinking about losing weight. Not advisable if you're having chemotherapy, but once you're out at the end of chemotherapy or other treatments such as surgery, radiotherapy, then that might be a good opportunity to really think about lifestyle, and your weight might be part of that. So one of the things I often get asked about is sugar. Lots of information about sugar in the press. I also, if anybody's Googled sugar and cancer, they will have seen millions of hits. A lot of them give good information. Many of them give information that is not correct. There is this idea that sugar feeds cancer, and it's certainly not as simple as that. So sugar in itself isn't poisonous or feeds cancer, but we do know that people who eat more sugar in their diet are more likely to gain weight. So that is why the health recommendation is to be very careful about how much sugar you consume. Sugary drinks are often singled out because in studies they have been linked to people gaining excess weight. So if you are somebody who does drink sugary drinks, then that might be something just to think about. In the United Kingdom, we now have stricter guidance about the amount of sugar in drinks. I don't know if that applies in India or other countries, but certainly looking out for sugar-free versions of drinks and choosing things, you know, water, flavoring them with lemon, lime, using unsweetened tea or coffee. Remembering that natural fruit juices also have quite a lot of sugar in. So if you're going to drink fruit juice, maybe just limit it to 1 glass a day. So the idea that sugar feeds cancer, put that to one side, that's not correct. But thinking about sugar in your diet, yes, it's a good thing just to be careful about how much you're consuming. And just to think about things like fizzy drinks. I know some of you won't drink fizzy drinks, but if you do, it's a shame I can't all ask all 100 of you how much sugar is in these drinks, but 35 grams of sugar. And just to give you an idea, in the United Kingdom, our recommendation is for people to consume no more than about 30 grams of sugar in a day. So something like a can of a sweet drink would take your whole allowance, if you like, for the day. It's 7 to 8 teaspoons. So just being very careful. There are also sugary drinks that have a lot more sugar than this. So you just need to be very, very careful about that. So we've touched on sugar. What about things like red meat? Now, I know a lot of you won't eat meat. Some of you will. What do we mean by red meat? Red meat would be any sort of red meat that would include things like beef, veal, pork, lamb, mutton, goat. It doesn't include chicken, which is regarded as a white meat. So the idea about limiting the consumption of red and processed meat is actually, the evidence comes from other types of cancer, not particularly linked to breast cancer. Much more evidence for meat possibly contributing to an increased risk of colorectal cancer. Processed meat, so that would be things like sausages, bacon, ham, more being linked to things like gastric cancers. But for overall health, then if you do eat red meat, a maximum of 3 portions per week, and the figures underneath are 350 grams to 500 grams, that's for the whole week. If you're thinking, what does a portion look like? It would be the weight of a pack of cards. And if you do eat any processed meat, keep that to a very small amount. But as I said, this doesn't apply to chicken. And other sources of protein, which would also be good to include in the diet if you eat them, would include fish and eggs. I'll come along to dairy foods a little bit later on. So fats. So what do we mean by fat? So there's two main types of fat we talk about, fat in the diet. Saturated fats, which would come from animal foods, such as meat, butter, cheese, pastries, cakes, and unsaturated foods coming from vegetable oils. And also you can get unsaturated fats from nuts and oily fish. So everybody needs a small amount of fat in their diet, but it's very easy to get enough. It's very easy to get enough. So the bottom line about fat really is being careful about how much we use, both adding to foods and using in cooking. And the reason for that is that all fat is a very good source of calories or energy. So if you're thinking about your weight, then that is a very important part of the diet to really consider and look at how much you're eating. But I'll also show you a little bit later on some studies that have specifically looked at breast cancer, people with a diagnosis of breast cancer, and getting them to follow a low-fat diet. And that seems to be a good type of diet to follow for people with breast cancer. So I will talk about that a little bit later on. So really important, I perhaps should have started with this because it's a nice positive message. Eating a diet very rich in whole grains, fruit, vegetables and beans. So at least 5 portions of fruit and vegetables a day. I always say it's a starting point, not a destination. So if you can eat more than 5, that's great, really good. Some types of diets lend themselves particularly well to being very vegetable based, but also in using grains, very much thinking about whole grains whenever possible. So that would be things like brown rice rather than white rice, wholemeal breads and wholemeal flours rather than white flours, and pasta, if possible, having wholemeal pasta at times. In terms of fruit and vegetables, fruit and vegetables that have been preserved, so they're either frozen or tinned, are also good to include in the diet. It doesn't always have to be fresh. And I think certainly in the United Kingdom more recently, people have had to change their shopping habits to try and get their shopping. They're only going to the supermarket, say, once a week, or they're having a delivery once a week. People are being a little bit more reliant on things like frozen or tinned fruit and vegetables. And that's absolutely fine, really useful to include. All are a very good source of vitamins and minerals, good source of fibre. Beans and lentils, pulses are especially good. So they can be incorporated as the main part of the protein part of a meal as well, which is excellent. I'm often asked what is a portion of a fruit or vegetable. So if you weighed it, it would be about 80 grams. In terms of what does it look like, I've just put some examples up here. It might be a portion of fruit, such as an apple, orange or banana. It might be a slice of a larger fruit, such as melon, pineapple, and there's just some examples there. And people say to me, but surely fruit's got lots of sugar in it. And it does have fruit sugar in it. However, if you have fruit as a whole piece of fruit, then it is mixed up with other things such as fibre, and you don't absorb it into the bloodstream quite in the same way as you would, say, from a sugary drink or from something like a glass of fruit juice. So fruit in its natural form is better than having fruit juice or fruit smoothies where you put a lot of fruit into a drink. And that's certainly better than using refined sugar. For those of you that drink, I'm showing you the United Kingdom guidance. Men and women, we're now advised 14 units per week as a maximum. and just down at the bottom of this slide describes what a unit of alcohol will be. I know some of you are probably not drinkers, but particularly with respect to breast cancer, there is quite a lot of interest about how alcohol certainly can increase the risk of breast cancer. There's a slight difference of opinion as to alcohol after diagnosis of breast cancer. The guidance really is to avoid it if you can, but if you feel you want a small amount of alcohol, then stick within these limits. So the information I've presented so far has really looked at healthy eating for everybody. And what I'd like to do now is just think a little bit in a bit more detail about, are there any specifics that particularly apply to breast cancer, and just pull those out of the evidence base. So what do we know from observational studies? So just thinking a little bit about the research base that we use. In an ideal world, our best evidence would be from getting people who have had a diagnosis of breast cancer, getting them to change their diet and following up who did the best on different types of diets. But sadly, those sorts of studies are few and far between. We don't have many studies like that. I'm going to present to you the ones that we do. But most of the studies are what we call observational studies. So they follow people following a diagnosis and then look at lifestyle factors that seem to confer a better or worse advantage to those people. So I've just summarised on this slide some of the key things that we know specifically about breast cancer. The first one, I did put quite a bit of emphasis on body weight, and really being overweight is to be avoided if possible. We do also know that once people have had a diagnosis of breast cancer, it's very likely that at some point during their treatment, they may gain weight. We know from quite a few studies, and we don't really know if that's people change their diet, people are less active, or some of the medication associated with the treatment actually encourage people to gain weight. But we do know that that's not great. So whatever your body weight is at the start of treatment, gaining weight's not great. And certainly if you've gained more than 10% of your weight, then actually I would say, yeah, that's something to really look at and see if you can do anything about it. As I said, many people gain weight. So if you find that's you, that's not unusual. You're not alone. But in terms of breast cancer, it's not great. Diets rich in fruit and vegetables appear to be protective. So all the things I just mentioned about having those plant-based diets are a good thing to have. Now the next point, this is a bit controversial and often discussed, but we do know from these observational studies that diets that are high in fat and high fat dairy foods may not be as good. And that's partly to do with breast cancer, but also to do with other diseases as well, such as heart disease. Now, the important thing here to think about is that people who eat low-fat dairy foods actually do quite well. So we think it's probably not the dairy foods per se, but more about the overall diet and the amount of fat that's consumed. So please don't take from this that dairy foods are bad. That's not what the evidence shows. It's probably more that diets high in fat are not good. And I've also put on the bottom of this slide, although this isn't a dietary recommendation, exercise is important and appears to be protective in terms of thinking about people who've had breast cancer. So what we now need to think about are what is the evidence from interventional studies. So these are studies where they've actually, people who've had a diagnosis of breast cancer have been allocated to a study where some of those people have been asked to change their diet, and then they've been followed up for a number of years to see, do the people following changing their diet, do they do better? So these slides are a little bit boring because they're just words. I do apologize for that, but perhaps we can discuss them a bit more in the Q&A at the end. So these studies were done a little while ago, but there's one called the WHELS study, and I just wanted to share this with you because I think the results from this, they're not very strongly conclusive, but I think they give us an idea. So these were a number of people, nearly 2,500 women, postmenopausal women, who within a year of diagnosis were asked to change their diet. They were actually randomized to a control group where they kept on their normal diet, or to have a very strict low-fat diet. So 15% of your energy from fat is roughly half the healthy eating recommendations. And we know people can keep to these diets for long periods of time, but then they're not always easy. They need people to make changes to the foods they buy, the ways they cook. So quite big dietary changes, but we do know that people can stick with them because we've got studies that show that. And they had lots of support to do that. And that's why I mentioned earlier on, if you really need to make big changes to your diet, I would encourage you to find some support, either speak to your local dietitian, or if it's to lose weight, then think about the weight loss groups. They didn't have specific counselling on weight loss, but they did have their weight measured. So let's see what happened. The first thing is they managed to reduce their fat intake, not quite to the 15% that they were encouraged to do so, but they did make really good reduction to their fat intake, and they kept that going for over 5 years. But what the other effect it had is they actually ate less energy. So that means they ate fewer calories, and they did lose a bit of weight. They lost about 6 pounds. So that wasn't the aim of the study, but they did lose a bit of weight on this type of diet. They had an improved lipid profile, so it meant that they were healthier in terms of risk factors for heart disease, and a slightly reduced risk of relapse in the intervention group. So the group that followed the low-fat diet did slightly better. Now, what we've never really managed to work out, the researchers, is whether the benefit was the low-fat diet per se, or was it the fact that they lost a bit of weight? And there's been a lot of discussion in the literature about that since. And we don't really know the answer to that, but if you need to lose weight, then this type of diet is a good one to follow. So I was just going to give you a little bit more detail on what did their diet look like. So these are the sorts of things they learned, people on the study learned about what fat was, how you could actually choose lower fat foods. Now, they were given quite a sophisticated plan where they actually counted grams of fat each day. They were taught how to read food labels and to sort of keep a running total of how much fat they were consuming, and to set specific goals about areas in the diet where they could reduce their fat intake, such as oils and dressings, choosing low-fat dairy products. Remember I said low-fat dairy products were really good to include. Low-fat sources of protein, having more fruit and vegetables, and choosing low-fat desserts, etc. But then really important, and I think this is why having support really makes a difference. For any of you who've tried to change your diet and then just slip back to your usual ways, that's what normally happens to people. Really thinking about, you know, what would help you stick to a diet, removing what they call some of the roadblocks, some of the barriers, tempting environments, you know, if you go around to friends or family or you eat out, and thinking about social eating. So it's all right to have the information, but you really need to build up a sort of support mechanism to help you keep to it. And the other study I wanted to mention, this is also one of these intervention studies. So it's a study where people were randomized, they were allocated to different groups. And this study, we call it the WHELS study, looked at a large number of people, about 3,000 people, a little bit longer after diagnosis. So they took people on the study up to 4 years after diagnosis. And they were particularly interested in reducing fat intake, like the other study was, but also really encouraging people to eat lots more fruit and vegetables. So vegetable juices, 3 portions of fruit, very high fiber, up to 12 servings per day of fruit and vegetables, you know, which is huge. That's really a lot to ask people to eat. Now, in this study, they didn't really lose weight, and after the follow-up, they didn't really see any difference in whether the breast cancer came back or whether people succumbed to their breast cancer. So not quite so conclusive as the last study, which was a bit unfortunate because I think we were all thinking that this type of diet would make a difference to whether the breast cancer returned or not. Now, since then, there's been a lot of interest in, was it actually the weight loss that helped people? So there've been a number of studies looking at trying to encourage people to lose weight, because lots of people say to me, oh, but I can't lose weight. Since I've had treatment for breast cancer, I can't lose weight. I really, really struggle. But I think what these studies have shown, so this was an American study, and this was written by a British dietitian after she's done some studies looking at people after treatment for breast cancer. And I think the outcome from that is that we do have good data showing that people with the right support, people can lose weight. And this was a study published a number of years ago now, looking at people at 12 months. The intervention group is the blue line, and looking at the proportion of people who lost weight, 5% of their weight, 10% of their weight. And then after 2 years, they still managed to keep, some of the groups still managed to keep their weight off. So that was really, really good. So my research as well was looking at people with breast cancer who'd got lymphedema, and I was encouraging and supporting people to lose weight. And in the groups that I had, people did lose weight, but they just have to have, got to be highly motivated and have the right support. So don't be despondent if you think, oh, it's just too difficult to lose weight, because it can be done. So thinking about specific dietary components, one of the things that I often get asked about is dairy foods. And there's been a lot of bad publicity about dairy foods, a lot of controversy, but these are the sort of headlines from some of the reviews that have been published. And more so now, we really think that dairy foods in the diet are a really good addition, and they're not related to breast cancer outcomes unless people are having very high fat diets and having high fat dairy foods. So I think the overall message is that please include dairy foods in your diet, because they're a very good source of calcium. But when you do so, possibly think about choosing some of the lower fat dairy foods where you can. So maybe some of the lower fat milks and some of the lower fat yogurts, and having cheese if you eat cheese, but maybe in moderation. But certainly not excluding dairy foods from the diet. That's not necessary. What about phytoestrogens? So phytoestrogens are plant-based substances present in some foods, particularly soy foods, and they act in the body by binding to, don't worry about all the abbreviations on this, they bind to some of the estrogen receptors on the cells, but they're not actually estrogens. They're substances that are similar to estrogens. So it isn't the same as the estrogens that are produced by the body. They do bind to some of the estrogen receptors, but they're very, very mild in their action. So which foods contain estrogens? The main group of foods are the soy-based foods. And I've just put up some of the lists there of some of the fermented and unfermented soy foods in the diet. Increasingly in the United Kingdom, people are using more soy foods in their diet. But I think the important thing to think about with soy foods, these phytoestrogens, some of them may bind to estrogen receptors that have a role in stimulating cell growth, but other types of estrogen receptors have the opposite effect. So when they're stimulated, they will decrease cellular growth. So there are different types of estrogen receptors. And as I said earlier, these phytoestrogens or isoflavones are very, very mild when compared with our own estrogens. And actually the evidence for soy-based foods in the diet and risk factors for breast cancer, these food items appear to be protective. And we know that from countries, particularly countries where lots of soy foods are eaten. So the studies that have looked at eating soy foods, soy isoflavones, and that's just a word meaning these phytoestrogens, and soy protein, actually these foods appear to be beneficial. The only thing I would say is that supplements of soya or supplements of isoflavones, and you might see these in the health food shops as things such as red clover, then they are not recommended. Now, the American Cancer Society used to say limit soy foods to 2 portions in a day, but more recently there's been a systematic review published, and actually that restriction on number of portions has been lifted. So soy foods in the diet are absolutely fine to include, but don't take soy protein supplements or isoflavone supplements such as red clover. And what about other supplements? I'm often asked if people say to me, oh, should I be taking a vitamin and mineral? Well, if you can follow the advice that we've talked about today, then you shouldn't need a vitamin a mineral supplement unless your medical team particularly think that you need a supplement. So examples of that might be vitamin D and calcium. Really important to think about vitamin D and calcium. We certainly in the United Kingdom, we don't get enough sunlight really for our vitamin D levels to be good. Or iron might be another nutrient that if your medical team think you're deficient in iron and you need to take a supplement. But all the other vitamins you should be able to get from your diet, and we don't have any evidence that it's helpful for your cancer to take a supplement. In fact, we do have studies in other types of cancer that show if you take vitamin and mineral supplements, particularly high doses, then the risk of some cancers may well be increased. So the overall advice is you shouldn't need to take a supplement unless you have specifically been advised. So what about the menopause? Is there anything in terms of your diet that is helpful? Now this is general information. If your weight is in the normal range, that's thought to be helpful. Exercise, really important, thinking about resistance exercise. Very important to have that discussion with your medical team about bone health and vitamin D and calcium intake. Quite a few of my patients will be taking vitamin D and calcium. Consider your heart health and think about including 2 portions of oily fish if you're a fish eater. As I said earlier, not to use isoflavone supplements like red clover, but also to think, do caffeine or alcohol make your flushes worse? because sometimes there have been some studies that have shown that these aspects of your diet may actually make your hot flushes worse. So you might need to just think about that. Resources and information. For those of you that are particularly interested, the World Cancer Research Fund update program on breast cancer survivors. So this is more of a technical report. If there are any people who are healthcare professionals, or you know, it's accessible to everybody. This is on the website. The World Cancer Research Fund resources I would really recommend. And one of our organisations, I'm sure you have similar organisations in your country, Breast Cancer Care, our UK organisation, produces a leaflet on diet and breast cancer, and it's also as an audio as well as a written information. What we really need to think about is good food that tastes good, does as good. Just some examples to show you. And a couple of books I would recommend as well. So the 2-Day Diet book, so that's a little bit like the 5-2. And Michelle Harvey is a dietitian. She's done work looking at this diet and breast cancer. And basically her sort of summary on that is some people find it easier to follow doing a 5-2 diet rather than trying to restrict intake every single day. And that works for some people, doesn't necessarily work for everybody. And this book at the bottom by Tricia Greenhalgh and Liz O'Riordan, that's generally on breast cancer, but also has a chapter on diet, which is really good evidence-based information. So thank you for listening. I think we've got a few minutes left just for questions.
Thank you, Claire. So we have a lot of questions. Thank you so much. This is brilliant, actually. And I have read Liz and Trisha's book, and I've heard Liz speak as well.
Yeah.
She's amazing. And,
she is really
I'm
good.
going to try and get her to come to one of our meetings.
I'm sure she would. I'm sure she would. She's very active on Twitter.
Yes.
She's really, she's really good. Great speaker.
Actually. Yeah. So I think one question that is in everybody's mind is to do with the soy and ER positive. You touched about it a little bit. So one of the questions is, do flax seeds have phytoestrogens?
Flaxseed have lignans in them, so slightly different type. I think the short answer is yes, they're a slightly different type of phytoestrogen, and they're made from substances in flaxseed, and when they are digested by bacteria in your gut, they produce a type of phytoestrogen. So the answer is yes, they're mild, and they can still be included in the diet.
So one can have like a teaspoon a day or something. It should be.
You could have more than that. Yeah. More than that. I know some people, you know, might include like a tablespoon in their cereals, or that's absolutely fine to have. The advice certainly about phytoestrogens in the diet is more relaxed now than it has been in the past, because the systematic reviews published in the last couple of years have shown that phytoestrogens just from diet are absolutely fine and may actually provide a benefit.
So for ER positive breast cancers, you know, most of the ladies are on tamoxifen or letrozole.
Yeah.
So are there some foods that they should avoid? None, because we don't take industrial quantities anyway.
No. Because even studies from countries like China and Japan, where their intake is much, much higher of phytoestrogens, they still appear to confer a benefit, if anything, including for people on tamoxifen. So as long as they're not taking supplements, they're absolutely fine to include in the diet.
Things like, and sesame seeds are also fine, I think one of them.
Correct, yes.
So, and the other question is the amount of wheat per day, or you could say the grains per day that people have. Is there a guidance on that?
There isn't really, there isn't. You probably have to take it in the context of what other starchy carbohydrates are you using. So starchy carbohydrates would include things like rice, potatoes, beans, pulses, lentils, So there isn't an overall limit.
Mm-hmm.
If people are trying to lose weight, then the starchy carbohydrates might be something they need to look at in terms of portion sizes, but there isn't a limit on how much people, you know, should have.
And with COVID going on, I think the same situation is in London as well. Are you recommending anything to boost immunity during COVID times? And that applies for, I think, the same question that has been asked about chemotherapy as well.
Yeah.
We talk about turmeric, ginger, and all of this stuff. What do you say?
Yeah. Good question, Papa. So in terms of immunity, very early on, we flagged up vitamin D. So we know it's very important for bone density. We also know vitamin D is important for the immune system. And we also know that people are staying inside a lot more. So 10 micrograms of vitamin D as a supplement, we are suggesting in the UK, our nutrition groups and us at the Marsden as a hospital, we put that recommendation out quite early on, but it was really because people were shielding and not going outside rather than any strong evidence that it's going to boost the immune system. In terms of, are there any diets or foods that boost the immune system? The answer to that is sadly no, there aren't. So good nutrition overall is the best you can do for the immune system. There's no specific foods or nutrients that will boost the immune system. In terms of things like ginger and turmeric, we encourage people to use them in their diet. We don't really encourage supplements of things like turmeric, particularly if people are on chemotherapy, because we don't really know how they may interact with chemotherapy. And there is quite a difference between using turmeric, say, in your diet and using it in cooking versus the amount you would get if you take concentrated supplements. So we're a fan of it in the diet, but not a fan of supplements.
Yeah. And I think with vitamin D, there is enough evidence to show, at least in breast cancer and a few other cancers before chemotherapy, that if you replace it, the toxicity of treatment is also less.
Okay.
So routinely vitamin D levels before, and it seems to be low in Asians more than, despite the melanin, despite enough sun in India.
Yeah.
But
Okay.
somehow we tend to have a lower vitamin D level.
Okay. Oh, well, in the United Kingdom, our vitamin D levels are really not good at all.
Yeah.
And there's been a lot even in the newspapers, in fact, the days the stories that were out in the newspapers about the importance of vitamin D levels. I think then it became impossible to buy low dose supplements for a few weeks, because I think everybody was buying them online. But we do say, yes, that's really important.
And the other thing, which is, you know, all of us ask, and I also want to know as well, which cooking oil, what should you cook in, whether, so in India, the stuff that is easily available is mustard oil, sunflower oil, coconut oil. And so whether it should be cold pressed or, you know, so for which oil do you think ghee is available? You know, ghee is clarified
butter. Yes.
So what do you recommend?
So in terms of, we're thinking breast cancer.
Yeah.
Ideally oils that are monounsaturated. So they would be things like olive oil, but it doesn't need to be virgin olive oil. That's not good for cooking. Mm-hmm. Ghee and coconut oil, they are both saturated fats. So do you remember I said earlier, high fat's not great, high saturated fats are not great. So coconut oil, there's been lots of publicity, particularly on social media, about coconut oil, but it isn't a great oil to use. Mm-hmm. Ghee, I know, is used quite a lot, but again, probably not the best. A little while ago, there was a move away from some of the vegetable oils, but I mean, my first point I would always make is be sparing with oil. And I know that's not always easy in Indian cooking, because often it is quite oil rich. But then using more either rapeseed oil or olive oils that have a high percentage of unsaturated fats.
How about mustard oil or sunflower oil?
No, I don't know the fatty acid composition of mustard oil. Some of your nutritionists, we don't use that very much in the UK, but some of your dietitians who are in the meeting
might. I'm going to ask Ritika and Upasana there. I'm going to ask them to comment on it because I know you are time constrained, so we have you for 10 minutes. So I'll ask you first and then I'll ask them for the next 15 minutes.
Yeah, that'd be brilliant. Thank you.
Yeah, so I think they can get on to those oils. The other thing is intermittent fasting.
Yes.
Do people talk to you about that? Does it prevent?
They do. They do.
Recurrence or cancer?
Yeah, I'm quite a fan of intermittent fasting, actually. I don't think it's for everybody. So just for people who might not know what it is, it's a way of restricting calorie intake. So most of the books recommend for women, it would be 2 days a week, restricting their energy intake to about 600 calories. And if you think that most women might need about 1800 calories a day. So it's a very, very strict diet, but using foods that are high in protein to try and stop you feeling hungry. And also you need protein every day. So it's an important part of your diet. And then for the rest of the week, just following very sensible, healthy eating. It doesn't mean to say you can go mad the rest of the week, but it means you get an energy or calorie deficit, which overall encourages you to lose weight. And there have been some studies in breast cancer that have shown that people can still cope with it, they can still exercise, and it's safe to do so. You need to make sure you drink plenty of fluid, as opposed to normal method of dieting, which is to restrict your energy intake every day. It's no better or worse, but I think for some people it may fit their lifestyle. And I've had people who've tried it and really found it helpful. And then they've used it an occasional day of a calorie restriction to help maintain their lower weight. Other people just find it too strict, too severe, and they feel very grumpy and they don't like it. But I think there's nothing magic about it. It's about restricting energy intake over the week. But for some people, I think it is useful. But I would always say, you need to either get support from a dietitian or you need to read the books well and really plan what you're going to eat. It's not just about not eating and making up your 600 calories from foods that are not great, like chocolate or something like that. You need to do it properly with high protein food and snacks.
So, but I don't think there's a question whether it's good for diabetes. Probably not, I would think, no, because
it depends what sort of diabetes you have. If you're on insulin, definitely no, you need to consult with a healthcare professional. For type 2 diabetes, depends what sort of medication you might be on. If you're diet controlled diabetic, then it may be suitable. And I would say, speak to your doctor.
Mm-hmm. And protein supplements recommended during chemo? I mean, do you recommend supplements? I actually tell patients to try and take it from diet as much as possible.
Yeah, that's right. So we only use protein supplements in very particular circumstances. Most people should be able to eat enough protein in their diet. They might need to think about what they're eating. But very unusual for us to be using protein supplements. People would really have to be struggling. So yeah. I would agree with you, Bhawna, not really necessary.
Great. So I think, Claire, I'm going to let you go.
Thank you
so much. We are so grateful.
You're very welcome. It's been lovely.
Thank
lovely
you.
to talk to you.
Repeat it again in 6 months or so.
Brilliant. Lovely.
Thank you.
Thank
so
you.
much. Very grateful.
Bye.
Thank you. Bye.
Thank you.
So we have a lot of questions still, and I'm going to ask Ritika, our dietitian, to come in and or Upasana. So because there are some questions which are very relevant to us in India as to what type of oil, and there were some questions on Ritika. Are you here?
She's there, ma'am. Ritika Makkar, right?
So Ritika, can you answer about the mustard oil and the groundnut oil? Whether we can use that? What is the fat content? Because we know about olive oil.
I'm
And
sorry to disturb, but I am not a dietitian. There is a little bit of misunderstanding. There's another Ritika in the group.
so no,
I
no.
think
So is Upasna there? Upasna?
Can I take this question?
Yeah. Yes. Amita, are you a dietitian?
Yeah.
Please go ahead. Please. We're
Yes,
really grateful.
yes.
Thank you.
All right. Okay. I'll tell you because I've been counseling. I have right now also about 8 to 10 breast cancer women under me. So
Great.
I am practicing nutritionist. Okay. In the Indian context, the amount of total fat which you should be having on a daily basis is 2 tablespoons. That is number one, the quantity part. Coming to the quality part, I would strongly recommend using level 1 teaspoon of ghee, but in the uncooked form, not the warming. Don't warm it and use it. Garam karke nahi khana hai.
But that is a saturated fat.
Yes, it is. I'm sorry, but the omega-3, omega-6 proportion of ghee is excellent. Please don't go by all the Western this thing, okay, the findings. Number one. Number two, mustard oil is great because it is almost like the olive oil composition. So our mustard oil as well as groundnut oil are fine. You don't need to go to the olive oil component at all because you can't cook very well with olive oil in the Indian context. You can only use it as a salad oil. So that means it boils down to about 3 to 4 teaspoons, 3 to 4 teaspoons of mustard oil and groundnut oil. You can rotate the oils by using rice bran oil. You can use sunflower oil, canola oil occasionally. But looking at the cardiac profile, lipid profile of our patients, of our population, why should I say patients, our population, it is not a good idea to completely switch to unsaturated oils. Because please remember that in the Indian population, triglycerides, raised triglyceride levels are a very, very real situation. So please don't shift to sunflower oil completely. That is wrong. It will be counterproductive. So I will reiterate, 1 teaspoon of ghee. छौंक लगाना है, कढ़ाई में पहले प्याज डाल लीजिए, ऊपर से घी डाल के बस उसको हल्का गरम करिए. That's it. Don't cook the ghee.
I think can we just
3 to 4 teaspoons.
Amita ji, can I just say just one thing? Yeah. I think it is very important that whatever we say, there are a lot of patients here.
I know. I am a patient, ma'am.
Rebecca, I will ask you to speak in as well. It's very important that जो भी हम recommend करते हैं, वो evidence based होता है. By evidence, I mean that, you know, we publish the studies. So we do the study and then we publish it. Study से मतलब होता है कि what we do is like the WHELS study and the various studies.
Ma'am, I know.
Excuse
me, ma'am. Just 1 minute. I just want you to understand that I'm also a breast cancer. I'm breast cancer survivor. I've had a mastectomy also.
Thank you.
And I started my work at PGI Chandigarh. My first paper in 81, 82 was on this only. That's the reason it was published in Drug Bulletin. Okay.
I don't understand about the ghee heating.
Why don't we hear Ritika? Bhavna, let's hear Ritika on this.
Sure. Please,
let's hear Ritika's viewpoint here.
Come on, Ritika, can you speak, please? Or Upasna, are you there?
Bhawna, can I just say something? It's Rebecca.
Rebecca, please. I was trying to find you. Go ahead, please.
Yeah, no, I just wanted to say is that we have different states and every state has a different style of cooking and eating.
Completely agree.
Yeah. So I think when it comes to oils and comes to ghee, we have to look at our culture and you see from where we come, because we cannot eat mustard in Maharashtra.
Yeah.
Yeah. So we cannot have a blanket rule that this is good and this is not good. We need to discuss it with your own dietitian who's handling your, who knows you and your diet constrictions, because you can have, also I remember that ghee, anything that solidifies in room temperature is not good. So
it's a saturated fat basically.
Yes.
So that's what it means. Yeah.
And we love ghee, so we'll have it on everything. So that's the problem.
But basically the point I was trying to make is vegetable oil, and that vegetable oil may be different in different, and what Clare was saying, coconut oil solidifies, ghee solidifies.
Yeah.
So all of that, that's what the studies have shown.
Yes.
That they are probably not good. But so I think I completely agree with you, completely, Rebecca.
Yeah.
So very important that we actually discuss this with specialist dietitians who actually have, and I would also encourage you all to read this book that Liz O'Riordan, she's actually a consultant breast surgeon and in UK, who's written this book along with a GP. And it gives you a lot of tips about not only diet, but other things as well, like coping with mastectomy. So next time, I think, do we have any more burning questions? I'm very happy to take them with Rebecca or with Amita or anyone else. If you have, please speak out or send a. So yeah, there's one question. Sorry, Mr. Sarda, we didn't get into it. How to focus on reducing chemotherapy pain while taking this therapy? So again, I would encourage you to speak to your oncologist. Chemotherapy ideally should not cause any pain. So the only pain actually that comes from chemotherapy is related to tingling and numbness. Sometimes the neuropathy can become painful, but chemotherapy itself doesn't cause any pain. So I think we've gone through all the questions.
Bhavna, one question on behalf of my survivors.
Sure.
Vegetarians, B12 deficiency, peripheral neutropathy, is there anything in diet that could help?
So I think the nuts are very, very good source of B12, hazelnut. And do you want to say something, Amita? Yeah, you want. I think nuts are a very good source. I was hoping a specialist dietitian should be able to address it. But meat is a very good source. But I think nuts would be a good source of oral B12. Otherwise, what I do is, if a patient is deficient, and when we do baseline bloods, if we find that the patient is deficient, I would actually give them injectable vitamin B12.
Okay.
Because it does so like my mother, I mean, she's deficient in B12 because they don't eat non-veg. So I would just give them weekly injections of B12 just to replenish it, and then try and have some foods which are rich.
So Bhavna, you can take this question also. Somebody has quickly asked me that, can she have a glass of wine during chemotherapy?
So, I got asked this question a lot when I was in London. And like Clare said, ideally no alcohol is good, but one glass of wine, 175 ml, 1 unit during chemotherapy is fine. What I used to say is that, on the day of chemotherapy, you should drink. Okay. So not on the day, but otherwise they can have, not a problem.
What about salt content? If anybody wants to ask a question on salt, because we love our salt also.
So yeah, again, too much of salt is not good for your hypertension. And, during chemotherapy, I've seen if you take too much salt, it increases the propensity to develop swelling also, causes water retention. So again, not be too, anything in moderation, I feel is fine. So the other thing is, I have neuropathy even after 7 years, any treatment for it. Again, if the neuropathy hasn't got better after such a long time, it is unlikely that it may get better. Because what we say is, the further you get away from chemo, the better it becomes. So if it is not, and if it's troubling you, I would suggest see a neurologist. Sometimes, you know, we can give medicines to stabilize the nerves, and also check your B12 and folate and vitamin D levels. So if any of those is deficient, then that can help. Dr. Vinita Goel, she's our amazing radiation oncologist I work with at Max Shalimar Bagh. Vinita, you want to make a small point regarding source of calcium? Dr. Vinita Goel, could we please unmute her?
So,
हाँ, Dr. Vinita, हाँ.
So Dr. Bhawna and everyone, it's a very good session. The only point I wanted to make is that ragi जो है जैसा सूजी होता है ना वैसा होता है देखने में.
हाँ.
It is little brownish in color. It is a very, very good source of calcium and iron and vitamin D. So I think it's a good supplement. And लेना बहुत आसान है उसको. आप कुछ भी बना रहे हो ना, जैसे आटा है, फुल्का बना रहे हैं, उसमें डाल सकते हैं थोड़ा रागी. I take ragi every day. I add a spoon of ragi powder in my curd every day and I eat it. It's a wonderful source of calcium, iron and vitamin.
So what is ragi? Is called ragi in English? Somebody is asking. Ragi is ragi in English? It's a millet actually.
I think so.
It's a red millet.
It's a millet. It's a millet. Yes.
Yeah. So it's a red millet that you can have. In fact, actually, it's a very good point. I take it as well. Either I take it in the form of flour, or I roast it and I add it on my salad or something. So another question, is milk good for breast cancer survivor? Like Claire said, you know, you can have it in moderation. So milk is fine. You don't have to avoid dairy completely. But the fat from the dairy in that study that showed that, you know, was not good. So, but a glass of milk, again, like in moderation, is fine. Is real juice of pomegranate help in increasing hemoglobin? So pomegranate does have, will help. But rather than having the juice, I always tell patients, why not have the whole fruit actually? Because it will give you fiber also, rather than the juice. So have the whole fruit as well. Alternative therapy for reducing side effects. I think we'll do a session on chemotherapy. And somebody said ragi same as nachni. Again, I would Google it actually, please. I have no idea. Does somebody has an idea? Yes, Dr. Vinita said ragi and nachni are same. So I think, thank you very much, all of you, for joining. We had about 155 participants today. Thank you so much. And the next session will be on, we'll do these sessions on the 3rd Monday of the month. And the next session is, like I said, Dr. Neeta Nair from Tata Hospital and Dr. Neeta from Max will actually talk to you on that session, and also about, you know, how to manage lymphedema, what precautions you can do. If you've had a sentinel node versus a nodal dissection, what should be done, what should not be done. So I think all of this we will discuss then, and we will talk about how to de-stress and positive thinking in the session on August. And I will post the other sessions down the line. Thank you so much. Bye-bye. So no diet advice for triple negative. So no special advice actually. This is the last question. Thank you so much. Bye-bye.